Hello friends, my name is Dr. Murtaza Adeeb. I am a practicing orthopedic and joint replacement surgeon in Pune. I'd like to discuss recovery time after a total hip replacement surgery. So this is a common question with people who are undergoing this kind of operation, that they are worried that this recovery will take a long time, etc. And what should they do and should they not do while recovering from this operation. So let me just guide you regarding the same. On the first day of the operation, in fact the day of the operation of the hip replacement surgery, we will allow the patient to just move their ankle and their knees to some extent. First day after the operation, we usually will refer the patient to physiotherapist, and they will come and mobilize the patient gently, usually with a frame, and they can walk around in the room, etc. They can even go and use the restroom. On the third day, we discharge the patient home. So there are certain things that you should not do after a hip replacement, and the first thing is that you should try not to cross your legs after having a hip replacement. It's better to sleep with your head with your legs apart like this, usually with a pillow in the middle. And the second thing is that you should not sit lower than 90 degrees. So you should sit on a chair but not lower than 90 degrees on the floor, especially in the first few weeks after the surgery. The reason for this is that this is an artificial joint, and if you push it to the extremes of movement, it might come out of the joint. So you have to give it enough time for all the tissues to recover. That usually takes usually around 6 to 8 weeks, and then you can maybe start doing some regular movements. Thank you.